This presentation is about trauma-informed care, the importance of it, and how it can be implemented. So what is trauma? According to the Center for Treatment of Anxiety and Mood Disorders, trauma is defined as a psychological, emotional response to an event or experience that is deeply disturbing or distressing. And so this means that trauma has a wide range. Many experiences can be traumatic, even experiences that are considered to be part of normal life, like the death of a family member, accidents, or even bullying. Most people experience this in their lives and in their childhood, but they can be traumatic. And once trauma has been experienced, the brain changes. A child's brain is constantly alert after trauma. Traumatic experiences trigger fight or flight responses in the brain, which get stuck on, especially in the cases of multiple ongoing trauma. The child's brain is then constantly in the survival mode, and it causes behaviors such as aggression, tantrums, anxiety, sleep disturbances, clinginess, and who experiences trauma? There is no specific demographic for those that experience trauma. Trauma can occur to anyone in any race, gender, ethnicity, socioeconomic status, and age. However, we do see that a lot of trauma begins in childhood. The Adverse Childhood Experience Study showed that as adults increase in the number of adverse childhood experiences, the likelihood of severe health issues in adult life would also increase. And some adverse childhood experiences are shown in the chart on the right, and these included substance abuse, parental separation or divorce, mental illness in the family, mothers who were abused, criminal behavior, emotional and physical neglect, and emotional, physical, and sexual abuse. So this means that the more traumatic events that occurred in a child's life, for every adverse childhood experience, and on the chart on the right, every one of those is an experience. And for every one event that occurred in the child's life, the more likely that the child would have health problems in their adult life. And so the problems that they could have include obesity, heart and lung disease, addictions, and depression. And that's just a few of the many health problems that a child could grow up to have later in life. In the pie chart on the left, it shows the prevalence of adverse child and family experiences among U.S. children aged 0 to 17 years. And as you can see, 52% of children have no adverse family experiences. However, on the other side of the pie chart, you can see that at least 48% do have at least one adverse family experiences. So that's almost half of children are experiencing some sort of traumatic event in their lives. So this is where trauma-informed care comes in. Because trauma is so common and affects the lives of so many children and so pervasively, by stunting development, triggering mental health problems, hindering relationships, and even affecting physical health into adulthood, it is imperative that those working with traumatized children are trauma-informed to prevent further traumatization and to enhance quality care for those children. There are 4 strategies to trauma-informed care, and there's a few basic principles. The first one is realizing the widespread impact of trauma and understanding the potential paths for recovery. The first step is just recognizing that trauma does impact children and even adults. And the second is to recognize the signs and symptoms of trauma. So once we recognize that trauma does have an impact, we need to learn the signs and the symptoms of trauma in any clients, families, even the staff that are working with the children, and others involved with the system. The third step is to respond by fully integrating knowledge about trauma into the policies and procedures of the organization or agency. And then lastly, you need to seek to actively resist re-traumatization. And this could be, re-traumatization could be in any aspect. It could be in the medical field when a child is getting a physical exam after being sexually abused. The doctors and the nurses have to be trauma informed so that they will not bring up more trauma and more memories and feelings that they had when they were sexually abused. And this could also be, it could be even as small as speaking in the right tone to a child who has maybe been physically abused by getting yelled at or hit. And so being aware of our body language and our tone of voice, the way our face looks while we're talking to traumatized children, it all matters. Trauma-informed care prescribes a set of basic principles that we must integrate when we are working to be trauma-informed. And these are safety, trust, choice, collaboration, and empowerment. So with the 4 strategies of trauma-informed care in mind, implementation of trauma-informed care begins at a foundational level within the organization, agency, school, hospital, anywhere. It has to begin in the foundation of the agency, and there has to be awareness and planning. Here's a roadmap to trauma-informed care, and this is kind of just an idea of how to set up trauma-informed care within an organization. On the left, you have where you're setting up your agency to be able to be trauma-informed. And it includes recognition and awareness of trauma. It includes foundational knowledge, which would be like what the signs and symptoms are and how to deal with the signs and symptoms and behaviors of trauma. The next would be agency readiness. This would be training any new workers or even old workers on how to be trauma-informed. It'd be possibly hiring more if you can, so that more people can help these children who are traumatized. And then it includes the process and infrastructure, and that could be making sure you have enough room to process all of these children. And so on the right side of the roadmap to trauma-informed care, you have the implementation phase. And this is after everyone has become aware and learned about trauma, learned about the signs and symptoms. You start gathering information about the different kinds of trauma, and you prioritize and you create a plan. And from this plan, you implement it and you watch it to make sure that it is doing what it's supposed to do. And if it does not, then you start over. If the plan does work after implementing it and monitoring it, then you can adopt the policy and practice. So what strategies would workers use to implement trauma-informed care? We have to remember the principles of a trauma-informed approach. And these include safety, trustworthiness, empowerment, collaboration, peer support, choice, and historical and gender culture experiences. And this means on a basic level, the child needs to feel safe, whether this be from be safety physically or safety emotionally. This could be supplying food. It could be giving shelter. It could be listening to them without judging their feelings or reacting emotionally. It's becoming that safe place that the child can go to. And even though you might have them throwing a tantrum, they still feel safe doing so, and that they will not be abused or neglected afterwards. From this safe approach comes trustworthiness. Developing trust with the children. This means following through on the things that you say you're going to do, being there for them. It includes sticking sticking to policies and procedures, and making policies and procedures clear from the beginning. Empowerment is using opportunities to show the child that they can achieve and grow. It's allowing them to make some decisions on their own, encouraging skill building, and praising them for it, and helping them boost their self-esteem. Collaboration means working together with other professionals in the community. It could mean working with therapists, with doctors, with their family members, and it's working together as a whole for this child's well-being. Lastly, it's important to keep culture and gender and historical experiences and their history in mind when dealing with children and any other person, because a person's culture and gender and history experiences make up who they are. And so all of these are very important when trying to implement trauma-informed care.